Okay, guys, here's our D for you. Here's discussion D. Chiropractic care associated with reduction in opioid use disorder in patients with low back pain. Study, design, and scope conducted by University Hospitals, Connor Whole Health. This retrospective cohort study leveraged data from the TriNetX Research Network, a global health research platform. Aggregating electronic medical records. The study analyzed 49,308 matched patients between 2015 and 2025. Of whom were opioid native adults newly diagnosed with low back pain with or without sciatica. Patients were matched based on demographics and clinical characteristics to compare outcomes between those receiving spinal manipulative therapy or SMT from chiropractors and those prescribed ibuprofen. Major findings. The results reveal a striking difference in opioid related outcomes between the two groups. Okay, risk of developing opioid use disorder, 80%. Likelihood of long-term opioid use, 77%. Chance of receiving any opioid prescription, 31%. These findings suggest that chiropractic care, especially SMT, may significantly reduce the trajectory toward opioid dependency in patients with acute low back pain. Broader clinical implications. The study positions SMT as a viable first-line non-pharmacological intervention for managing low back pain, aligning with recent guidelines from the CDC and other public health bodies advocating for reduced opioid prescribing. It underscores the potential of integrative health approaches to mitigate these risks associated with opioid exposure, especially in early stage pain management. Given the ongoing epidemic, these results offer a compelling case for expanding access to chiropractic care, particularly in underserved or high risk populations. Expert insight: Dr. Robert Tra, Tra, Trager, 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 the study's lead author, notes: Our study is the first to directly examine opioid use disorder in relation to spinal manipulative therapy. This marks a pivotal shift from prior research that focused primarily on opioid prescribing rates, moving toward a more non, nonsense understanding of long term addiction risk. Equity and system level considerations for practitioners and policymakers invested in culturally responsive pain management. This study opens doors to rethinking care pathways. SMT could be integrated into community based models, especially in areas where opioid misuse disproportionately affects marginalized groups. It also invites exploration into insurance coverage, provider training, and, and public health uh, messaging to ensure equitable access to non pharmacological therapies. If you'd like to co design a framework for culturally adapted SMT outreach or evaluate its feasibility in rural or low resource settings, I'd be thrilled to help map that out for you. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.